It's all about your physiology. And so I have brown eyes. My dad had brown eyes. My mom has blue eyes. I really wanted to have blue eyes. Really wanted to have blue eyes. Can I will myself to have blue eyes? No. Can I get contacts that have blue in them? Sure. But I cannot use willpower to change my eye color. And that's what I would say would be my explanation of how willpower has nothing to do with this, because very, very common statement from my patients is, I'm lazy. And I'm like, no, we're going to reject that statement.
Welcome to Unmute with Priya, the podcast where silence ends, voices rise, and women rediscover the freedom to speak and live authentically, especially in life after 40. This show is proudly sponsored by Project Icon. I'm your host, Priya Sudarsanam. Let's dive into today's conversation. Today on Unmute with Priya, I'm talking with Dr. Laure DeMattia, an obesity medicine and family medicine physician who helps women stop blaming themselves for their bodies and start understanding their physiology. Dr. DeMattia has over 20 years of experience helping thousands of patients navigate their health journeys. She's also the author of the 4 Food Cues. And what makes her perspective especially powerful is that she isn't just a doctor. She's lived this herself. This is a conversation about shame, self-blame, and what happens when we finally stop believing that willpower is the answer. Dr. DeMattia, thank you for being on the show today. This is going to be a very powerful conversation.
Thank you, Priya. I look so forward to our conversation today.
Yeah. So before you were a physician helping women heal, you were a child put on a diet at 9 years old.
I was, yes. And I mean, it was a lot, because I was on a diet, but I had an elder brother who they wanted him to gain weight. And so it was a very confusing time. And my relationship with food was challenged.
Wow. And so what did that moment teach you about your body and yourself? I mean, 9 years old is a pretty profound time.
Well, at the time, it just was normal because that's what all our family of origin stories are. And it wasn't until much, much later that I figured out that was not the normal approach. And, this was in the 80s and there was a lot of pressure to look a certain way. And so I would say that my family was just trying to help prevent health issues and were concerned about the long-term ramifications. But I don't think we still are struggling to figure out how to deal with childhood obesity, 40 years, 50 years later. And so it was a lack of awareness, I think, at that time.
So even though your family, it sounds like they had the best intentions, what did this do for you throughout your life as far as
So I definitely, when I look back at that time, that was the beginning of my binge eating disorder. And it wasn't until I was in my late 30s that I was able to get someone to listen to what I was talking about, because binge eating was not its own diagnosis, until DSM-5. And I sought out a therapist who had a background in eating disorders. And when I presented to get some help about that, they said, well, you don't have an eating disorder, because they treated anorexia and bulimia, and I wasn't fitting into those categories. So, there's just a lot of, I know the term gaslighting is what people talk about very commonly now. But that's basically what I think a lot of people are experiencing, where they're told, no, that's not what's going on. And the reality is, once I got to a bigger center that had the understanding about binge eating, oh yes, you definitely have been struggling with binge eating for a very long time.
Wow. And you're helping, this is Unmute with Priya. We get to talk about all the things that we've gone through, and then actually starting to speak these things out loud, especially as we move into this second act of life.
Right.
My eating disorder was never really it couldn't have been diagnosed because it was below the surface, but it lasted until 42, 43. But it was, and one of the things that I realized that I battled with is that I was just trying to be super thin. And so there's so much focus on thinness. And we
There
were talking
is.
about this before. So I want your expertise on what your experience has been about that, because I'm so sick of it.
Well, we are on the same page. I feel like there was a period of time where I felt like we made some forward progress, where body positivity and really mindful eating, was kind of a lot of people were looking at that. And I feel like in 21, that kind of all went out the window. And we had made progress, and we have definitely slipped back into thinness is perceived as, the only route.
Yeah.
And I felt like I was hitting my head up against the wall so much with people coming in wanting to be put on medications that didn't qualify. They were maybe struggling with a little bit of overweight by medical standards, but didn't have additional health concerns that justified a medication that had, risks, benefits that outweighed what was going on with their health.
Right.
And wow, people were frustrated with me, so frustrated because I wouldn't give them what they wanted. I've been a doctor, I graduated in 2000, so 26 years in practice. And I feel like some of the more recent kind of discussion and just level of interest is almost to the effect, it feels like drug-seeking behavior for some people, where it's like a narcotic. And if you can't give this to me, there's like an eruption that happens, and people are super frustrated when I'm saying, in my medical perspective, my professional perspective, this is not worth the risk. Because I'm not saying like obesity, it's like a flip. For so long, I had to fight so hard for people to take the disease obesity seriously. I mean, patients and other clinicians. And now it's like, I don't know what's happening. And so I'm really happy to talk with people one-on-one. Like, that's my jam. But like doing lectures and like being in the spotlight is not something that I really enjoy. But because of all that's happened, I felt like I needed to start talking more about this and get out of my comfort zone and try to reach more people, because I do feel like this pursuit of thinness is going to really hurt some people.
Oh, yeah. I mean, I live in a really small town in New Mexico, and I'm hearing the word Ozempic and the medications on a daily basis. And I hear, it's I don't want to call it, what's the word? Obesity is a big issue out where I am, and with my other business, with the nonprofit, we're addressing adverse childhood experiences, where they found the correlation between adult obesity and adverse childhood experiences. But nobody's really being given solutions. Nobody's really being given like support to help them through this process. It's just, here's a medication, or there's nothing else than that. And so what are your thoughts on that?
Yeah. And so it's a really interesting tension, because there are people who absolutely's life have changed for the better being on the GLP-1 family of medication. So I don't want to give the wrong impression that I'm anti-medicine.
Right.
I am all about treating obesity because it is a chronic relapsing disease that we don't have a cure.
Yeah.
We have some treatment options. And so I am wholeheartedly in support of meeting people where they're at and trying to help them kind of figure out what path they need to take. And I'm saying diet and exercise. I'm saying diet, exercise, medication. I'm saying diet, exercise, medication, and bariatric surgery. So myself, I had bariatric surgery. I had a vertical sleeve in 2019 because I had tried everything to treat this disease. And by then I had been under treatment for binge eating for several years, like in 2011. And so I felt like I was stable from that perspective. There are some psychiatry people who feel like bariatric surgery can treat eating disorder. Like it can change the physiology. There's other people in eating disorder world who are vehemently against bariatric surgery. So it's like hot topic. So I just want people to understand that, yes, there is a path for treatment that can be very effective, but it's not without risk. And so people need to understand what they're getting themselves into And then so often what I'm faced is that just give me a jump start, doc. Like I don't plan on being on this for more than 3 months. And I want people to pause and understand that if you start a treatment path that is effective, whether it's diet and exercise, whether it's a medication, and then you stop that treatment path, the disease comes back, and so or it starts to express itself again. And so I've taken care of people. Like I had a gentleman who lost 200 pounds on his own.
Wow.
Why would he come see me if he lost 200 pounds on his own? Well, because all the things he was doing to help him lose that 200 pounds stopped being effective and he started to gain weight, even doing all the things that helped him lose the 200 pounds. And so for him, we ended up moving forward with bariatric surgery.
Okay.
And even that is not 100% like permanent. So it's a very effective tool that you only need to do one surgery, once, and then typically you get a very long kind of suppression of obesity. I had surgery in 2019. I think 2021, maybe 22, I started in the perimenopause, transition menopause. And I was doing the same things that I had been doing that helped me maintain. I initially lost 100 pounds with surgery and then pretty much stabilized and maintained 90 pounds. And I started to slip into gaining again. And I was like, oh my gosh, what's going on? I'm doing all the things. And I'm like, I'm my own experiment. Yeah. And I've had so many people who, never struggled with their weight. And then during that perimenopause to menopause, that's the first time they really struggled with weight gain. And that's super frustrating if you've been able to maintain your weight in a healthy place for 30 years, and then you're doing the same things and all of a sudden you're starting to gain 30 pounds. It is a time where we become more insulin resistant. We lose muscle mass because of the estrogen loss. And so then it's fairly easy for people to gain during that time. And so anyway, that happened to me. Yeah. And so I am on a GLP-1 to help maintain improvements in health. And I have so many things of why I chose bariatric surgery, because I had tried everything. I have been in a pursuit of trying to be healthy most of my life, sometimes not in a great way with, expression of the eating disorder. But after long treatment outpatient with binge eating, I felt like I had a better, kind of approach. So basically, being on the GLP-1 has allowed me to maintain about 90-pound weight loss. And so that's amazing. For me, that's what I need to try and prevent the cancers and the heart disease that run in my family so strongly.
Yeah, and what you're giving a voice to is the fact that it's not just a cookie cutter, one size fits all thing. You've tried different things, and it's about finding the right things and actually finding the right people to walk alongside of you on this journey. And I think that's a lot of times people don't have the right people walking alongside of them. So then
and that is something. So, there's been a lot of chatter about access to care. And so, I have a previous patient who, when I live in Oklahoma, was treating her in Oklahoma. She moved to New Mexico, and she does not have anyone within 3 hours that has a specialty in obesity medicine. So she'd have to travel that long to get to someone. There are online providers, but sometimes that just saying I prescribe the medicine doesn't mean that they have that understanding of the true, the full treatment of obesity medicine. Right. And so you just want to, I would say if someone's curious, I'd be looking for someone who is board certified. abom.org is where people can go to look for providers that have that extra training in their area or who provide telehealth options in where they're located.
Oh, that's amazing. Yeah, we'll definitely make sure to put those links as well. Okay. I want to talk about the guilt, shame, regrets cycle, because that cycle keeps women stuck in cycles of binge eating, restriction, self-blame. What's your experience with that, or how have you helped yourself to get out of that cycle?
I am Catholic by upbringing, and I didn't even really understand shame until I was in my 40s. I thought it was guilt. And so there's a big difference between guilt and shame. And I did some extra training with Brene Brown's Daring Greatly approach. And so it was really that work that helped me because of my eating disorder treatment team. They were immersed in the work that Brene had done for both addiction and eating disorder, and really trying to differentiate guilt being I have done something and bad and I want to change my behavior, and shame is I am bad or I am wrong. And so there is a big, big difference.
Massive.
And so shame, there is no place in the treatment of obesity for shame. Like I worked super hard to try and change how people talk about themselves. Like I'll have people say, I'm lazy. And I'm like, no.
I hear that a lot.
I rebuke that. We're not going there. You're in school, you're a single mom, you're raising 3 kids, you work full time. Like those are your priorities right now. And that needs to be the priorities right now. And so the wanting to work on yourself and get, a routine of exercise and eating differently, like that does not have the same level that maybe all these other things that are coming for your attention. And so that's what I'm seeing when you're talking to a patient. That's what I'm seeing often is that people are being stretched so thin to just do life. And then on top of it, they want something to change in their health.
Right.
And so it's like, we just have to figure out what is your value. Like I really try to get people to what lines up with their values. And so can we find something that is aligned, that's going to help you push through when there's something that's knocking you around? We need to really figure out, I would say an example would be like freedom of movement. Is a lot of people want to be able to go for a walk without pain. So we try to like, okay, so that's what we're going to talk about. And like, what can we do, even if it's just 5 minutes a day, to start getting a habit formed that is in line with the why. We need a strong why.
Yeah, strong why. That's I think for anything, a strong why will go a long way. In your experience, when a woman feels, or not even just a woman, because you've worked with everyone, what does it do to a person when they feel like their body is, physiologically and psychologically working against them? What have you found? Or especially when they're hearing, you have to have more willpower, and then they feel they're in that guilt, shame, regret cycle that they don't have the willpower. What have you found?
So I really, probably come off very strongly about like willpower has nothing to do with this.
Awesome.
Like, yeah. And so some
That's
people,
good, because I've heard it my whole life.
yeah, it has nothing to do with it. And I'm just one voice, and if you've gotten messaging your whole life that willpower is really what's driving the bus, it's going to come across like strange that I'm saying that has nothing to do with willpower. It's all about your physiology. And so I have brown eyes.
Okay.
My dad had brown eyes. My mom has blue eyes. I really wanted to have blue eyes. Like really wanted to have blue eyes. Can I will myself to have blue eyes? No. Can I get contacts that have blue in them? Sure. But I cannot use willpower to change my eye color. And that's what I would say would be my explanation of how willpower has nothing to do with this. Because so like a very, very common statement from my patients is I'm lazy. And I'm like, no.
Yeah.
We're going to reject that statement. I'll say, okay, I was at the grocery store. I was trying to carry, I thought, a 25-pound bag of flour. And I started to get on myself because I was like, oh my gosh, this is so heavy. And I'm just like, what is going on? I'm so weak. And I was like beating myself up. And I'm like, I got to start working out harder, more weights. And then I get home and get the flour into the pantry. And it's a 50-pound bag of flour. And so it was double the amount that I was expecting myself to be able to carry.
Yeah.
And so but that quickly, I went down the rabbit hole of like really getting on myself. And then when I found out, oh, it's 50 pounds. Okay, maybe I wasn't, like my expectation and the reality weren't matching up, but I don't carry 50 pounds around, and I don't, right. I mean, there are people who can carry 50 pounds, no big deal. Great. But I'm saying we need to really figure out our physiology and what works best for your physiology, because everyone has a different experience. And there are so many people who've had like the experience where maybe they've tried the GLP-1 and they're like, is this what other people's brains are like? Like they're not constantly thinking and being told they're hungry. And I'm like, yes, this is how other people's brains work.
Wow.
And I can parallel sometimes with like attention deficit disorder. A lot of people, when they get treated, they're like, is this how other people's brains think about doing things? I'm like, mm-hmm. And so there's certain areas in medicine that are less controversial, less triggering, and weight is not one of them.
Right.
Maybe blood pressure is. And so like when someone's blood pressure is not controlled and they're on 2 blood pressure medicines, I don't tell them they need to try harder. Like I will figure out what they're doing. Have they kind of slipped and started to eat more salt-based kind of foods? Have they stopped exercising? Like I'm thinking of a guy he was like, yeah, the past 4 months, it's been so cold and I just haven't been exercising like I used to, because I had evidence from the summer that his blood pressure was perfectly controlled. And it was really because that had kind of slipped away. And so we kind of refresh and like, okay, let's get back to what was working for you. Some people avoiding salt is like really helpful. Some people need to have, a 30-minute cardio workout every day. Others, it's okay, I need 3 different medicines in order to get the blood pressure under control. And so that is not triggering, or like people don't blame themselves for their blood pressure. And that's how I want people to think about obesity. It's in the same boat as diabetes, hypertension, high cholesterol, and they're all chronic illnesses that all of them do better when we eat well and exercise well, but very few people can manage all those disease states with just exercise and diet. And when I put it like that, I think some people are like, oh, okay, I see.
Yeah, that's how I'm like, wow, this is a perspective that I've never heard, because willpower is pushed so much. And especially, and I lift and I've had trainers and it's all about willpower, willpower, willpower. And you put it in such a light that we can take that pressure off of ourselves that,
Well, so I played college basketball. So I know how to work out. I know how to push myself as a college athlete. When I moved to Oklahoma about 11 years this summer, I was like, okay, I'm have some time. I'm really going to dedicate some physical activity and really try to get things under control. And I started working out with a trainer. And I was doing double days, like not necessarily with the trainer, but like he was helping kind of come up with a plan.
Right.
And I was tracking my food and doing all that. And he basically called me a liar, when he's like, you haven't lost any weight. I'm like, mm-hmm. And I've upped my activity. I cleaned up my eating. And my body is just keeping me steady. I gained muscle mass. And so that was an improvement. But it wasn't really what I wanted. I wanted to lose some weight. And so I was like, sir, you better be careful how you are talking to me, because I'm not going to send anyone your way with that attitude. Like I would never feel safe sending any of my patients to you when you're telling that I'm a liar, because I'm not lying. And I am very educated about all of this. And so it didn't didn't continue.
Yeah. I mean, that's a trigger for me, especially working with kids in schools. And I've always worked in Title I schools, so obesity was a big issue. But hearing they're lazy or you're a liar, I heard that all the time from other teachers and administration. And so when you say that, it's like nails on a chalkboard for me, because no, you're not lazy. There's something here we need to figure out. Before we dive into the chef framework and your book, I wanted to know, just being a doctor and even in your own experience, do people hide this from their doctors when they're having, whether it's the relationship with food, do people hide this from their doctors?
I would say it can go either way. Like I've had people tell me in our first interaction, I'm basically apologizing for all the healthcare clinicians they've ever worked with, because there has been such heaviness and hardness on, like, you're not trying hard enough, and I'm going to withhold care because you're not trying hard enough. And like, that just does not make sense to me. And so the way my space was set up, they'd be in a comfy chair and there's a tissue box next to them. And often just in relaying those kind of years of experience, they would kind of start to
Wow.
emote and cry often. And it's why would you share with someone who's a jerk, about it? And that's so, yes, I would say it's not safe for sometimes for people to talk about it. I just recently saw a patient who he's studying to be a dietitian, and I'm back in full primary care right now. And he said, I have never had a doctor ask me for a 24-hour recall of what I'm eating. And that's just kind of standard for me, even if I'm not trying to like work on obesity. I just want to know what they're doing just so I have a frame of reference. And he was shocked, and so there's so like I said, I don't think everyone is safe to kind of get into that with. And that's where you can always say, hey, I would really like a referral to a specialist, about this, because most primary cares do not have the time in their schedule to really dig in. And so it's not a 5-minute visit, you need more time. And so for sure, I think there's people who don't feel safe.
I love having these conversations with all my guests because it makes me really reflect on, like, you are the person that I am the person that we're talking about. Because when I was struggling with my eating and I had that first diet and I couldn't get myself out of it, I went to my doctor, my pediatrician at the time, and he is Indian as well. And he told me there's nothing wrong with you. And he was just telling me to eat dal and lentils and rice, as if eating Indian food was going to be my solution to this. And it was later on in life, I realized all the issues that created it and why I needed to control that so much. And then once I healed those parts, then I started just being okay in my body. So yeah, I appreciate that so much that you offer that level of care.
Well, and it's not all like sunshine and lollipops. As a patient, I remember a dietitian who was in this eating disorder center telling me, my set point probably just was going to be at a higher spot. And I was like, I hear you. And I understand that that's what my physiology is going to push me to. But I'm saying I just know my family history. And if I'm struggling at this point in my life, in my 30s, it's going to be a very tough road in my 60s and 70s. And so I was looking for balance. Like, I understood, that because they were all about like, don't be on any medicine, eat dessert with every meal, and I'm like, I hear what you're trying to normalize my eating. I got it. Like, and I definitely, it really opened my eyes. Like, I do feel like I talk with people differently about, like, sometimes we just need to eat things that are fun, like it has no point. It just tastes good. Like sex and food are supposed to be pleasurable. And so sometimes we just need to have some fun food. And I think we now, with this like thinness, kind of attitude, it's like, no one can step outside of, everything has to be healthy. And so I don't see that side either. But I mean, I can understand when people are frustrated with, sometimes the healthcare provider is trying to do the best they can. And she was in line with their, kind of approach, but it wasn't what I ultimately needed long term. Like, it was good at that time to normalize my eating.
Let's talk about the chef framework. That's really exciting.
Yeah. So it was just a way of me to get people to look at themselves and how food related to. So chef is an acronym. C is for craving. H is for hunger. E is for energy. And F is for fullness. And I would ask people to rate themselves kind of throughout the day with those different kind of hats on. And because a lot of times people are not, hunger for a lot of my patients was not an issue. They were really not hungry.
Okay.
It was once I started eating, then my fullness, I couldn't find fullness. And so they would have to eat a very large portion to feel full. And so that was where I just wanted to see, like, what were they struggling with? And then were there certain foods that kind of made things tougher? And so for me, I know I'm Italian. Pasta has been like part of my forever, but a bowl of pasta for me was really a struggle meal because I would feel full, at the time, but then I'd be hungry very quickly, like an hour, hour and a half after. And for me, it was because my blood sugar was dropping. So like hypoglycemia. I was functionally hypoglycemic. And so then the body says, hey, let's correct that. And I need you to eat something. And how do we quickly correct a blood sugar that's dropping? It's going to increase craving for sweet or savory carbohydrate. And so that's where, if I can see like, oh yeah, you're right after an hour after eating, you're really struggling with, you want something sweet or chips, then it's probably because your blood sugar is dropping after that. So let's look at a mixed meal. And so making sure that people highlight fiber, highlight protein, highlight fat. And so the fiber is the carb, the fat helps keep blood sugar more steady, and then the protein helps keep blood sugar more steady.
And is the chef framework outlined in your new book, The 4 Few?
It is, yes. It is something, because I want people, like, a lot of times we're on a roller coaster and we don't even recognize it, so like we're just trying to get through the day, and our body is meant like to get you from point A to point B. It's about survival, not about evolving into the best version of yourself. And so sometimes we have to kind of step outside of that space and reflect. And so we have a really hard time. We're not great at when we look back, like even a 24-hour recall for some people, they're like, oh, what did I eat last night for dinner? I don't remember. And so it's not to make it like, I think a lot of people who've been in this space in the diet industry for so long kind of like, I don't want to write down what I'm eating. And it's honestly, for me, it's really just for your own benefit, to you to see, like, if are there patterns that you can pick up on. It's not about, you did something wrong here. Like that's not the point. It's really just to figure out what mixture works best for you. So my previous work, I was embedded in a bariatric surgery program, and the surgeon was vegan, and she could eat a sweet potato and be full for hours. If I ate a sweet potato in an hour, I would need something else. But for me, I know like protein first is going to help me stay fuller longer. And so if I only have one thing I can eat, it's going to probably be a protein-based option because that's what works for me. For her, fiber was really the best thing for her to eat to help her stay steady.
These are such amazing tips that you're giving just even on this episode. And this is just a short episode. So I want people to be able to access you and reach out to you and get that book. So how can people get in touch with you? Because I know you are a busy doctor.
So I would say LinkedIn, Facebook, we're working on, I have launched a YouTube channel, Navigating Obesity with Dr. D. I'm starting a school community to be able to kind of go in more in depth. That is just on infancy. So I would say the YouTube, if you want to kind of see more and interact more. But then on Facebook, it's just Laure DeMattia, and you can friend me or follow me on Laure DeMattia on Facebook. And yeah, I want to build a safe space in the school community for people to be able to kind of process and get some, like, I think we can help each other. It's not like I don't have to be the teacher all the time. Like, I think people who've kind of gotten a little bit further can help guide, like, and help people move forward.
Amazing. So we'll make sure to put those links in the show notes. And your book is available on Amazon?
Amazon, the 4 food cues. Yeah.
Awesome. We'll make sure to put that there too. So for anyone who's listening, for that woman who's listening right now who just feels exhausted from trying and failing, or feeling like they're failing and trying and thinking that nothing works for me, what message do you have for them right now?
You are enough just as you are right now. I want people to avoid this arrival fallacy that so often is tied to weight loss. There's this idea that once I lose 50 pounds or 20 pounds, that I'm going to arrive and everything's going to be better. And my experience is your body might be different, but life is going to be still the same struggles, ups and downs. And so I want people to enjoy right now and try to seek out happiness in the current body they're in, and try to figure out how to just be the best with what they got going right now, instead of like, I have to have this big transformation before I can allow myself that privilege.
That's awesome. And I hope anybody who's listening to this who resonates with the message really takes that to heart. Thank you so much, Dr. DeMattia. Did I say it properly?
Yes,
I think
yes,
I might have said it incorrectly in the beginning. So
you said it was the Italian pronunciation.
I said DeMattia in the
Yeah.
beginning. Okay. So, all right. Well, it was wonderful to have you on. I look forward to further conversations. I look forward to people actually learning from you on your YouTube and knowing that they're not alone in this journey. Thank you so much.
Thank you so much, Priya, for having me. It's been wonderful.